What are these GLP-1 medications like Ozempic or Mounjaro?
And this is a stellar drug of the century.
I think which is common. Everybody's talking about it and everybody is taking it.
Absolutely.
Weight loss drugs.
They have taken the world by storm.
Hello everyone, you're watching Nukta. I am Qurat Ul Ain Mohsen. Dr. Fazeela Abbasi has joined us today, who is one of the most recognized dermatologists in South Asia and the Middle East. Trained at King's College London, she has become a leading authority in regenerative and anti-aging medicine. Dr. Fazeela, how are you?
I am very well, and thank you so much for this overwhelming introduction. That's always very kind of you, and I'm glad that we are doing this together once again. I think it was a wonderful experience working with your team last month when we shot for Nukta.
Yes.
And this is going to be yet another adventure for both of us to experience. Yes, and the audience is going to have a lovely
Yes, our audience loved it so much. So we were
experience.
Like, let's do it one more time. And we have her again in our studios. And today we are going to be talking about one topic, I think, which is common. Everybody's talking about it and everybody is taking it.
Absolutely.
Weight loss drugs. In the first part, we are going to be talking about the general understanding. Because you're a doctor, you can explain it better.
Absolutely.
What are these GLP-1 medications like Ozempic or Mounjaro?
Qurat Ul Ain, first, I think I would just like to reiterate what you have said, and I'm going to emphasize a bit more, and that is that weight loss drugs, they have taken the world by storm. You know, everyone is not just talking about it, but they're thinking that they're the right candidates for that. And I would not be exaggerating out of my teeth if I say that this is going to be, and this is a stellar drug of the century. After Viagra and Cialis, I think the human audience is in awe for this drug because it can just give them magical results in a very short span of time. And you were just giving me an example of your friend who lost weight and you were amazed to see her transforming like that. What food and lifestyle and exercise could not do for her, this is what the weight loss drugs, they're doing for people. But as you very rightly said, it has to be done under medical supervision. And I would like to say, it can be a boon and it can be a bane for you. A boon means that this can be a blessing. You know, when something is not working for you, something hasn't worked for you, and then there's a drug which is actually making you lose weight, it's a blessing. But it becomes a bane and it becomes a pain, and that pain can be having life-threatening side effects. As you very rightly said, we are very familiar with Ozempic. So there is GLP-1 agonists, the first generation of drugs, and then we have Wegovy, which is for the weight loss. And this was by this Danish company, Novo Nordisk. And I think they have paved the way for the other companies to jump in. And then there was this American company, I think they're taking a lead in this arena now, and that is Eli Lilly. And they have come up with Mounjaro. They have come up with Zepbound. So those are the drugs which are actually for weight loss, and the FDA has given their approval for that. And now, as we are talking about these drugs, which is like currently in fashion and in vogue, there is this new category of drug which is called the retiratide, which is going to be in clinical trials. I think they have completed the trial 2, but it's going to be in trial 3. And that is going to have a triple action. So it's not just the GLP-1 and the GIP agonist, but this is also going to act on the glucagon receptors, which is going to be like something which is mind-blowing because it's not going to have all the baggage of side effects that we are looking with these drugs.
If somebody's taking these drugs, how do they work in their body?
Okay, so number one, they're going to hijack the system, right? So they're not going to encourage your body to do what they're doing. Your body is still, the factors are still the same if someone is fat. As you said, my friend had hormonal imbalance. It's not going to fix the hormonal imbalance. So it's not going to fix the root problem, but it's going to hijack the whole system. So in a way, as long as you're taking them, you're going to be good. When you stop taking it, all the factors and everything is going to come into action and play once again, and you're going to be back to square one. This is one thing which needs to be established. It's going to act at 3 levels. It's going to delay the gastric emptying of the food content. It's going to release the GLP-1 from the intestines, and it's going to send a signal to the brain that I feel full. I don't feel like eating. If the food is in front of you, don't feel like eating it. And number 3, it's going to tell your pancreas to release insulin. And insulin is going to lower the sugar levels in your blood. So that's why these drugs are given initially, of course, that's where the introduction came, that this was given to the diabetics because they have insulin resistance and they have problems in their sugar metabolism. So that's why it's going to lower the sugar level. So that's how the GLP-1 and the GLP-1 agonists are going to work.
I mentioned my friend to you. She was saying that I've lost this, so it's not going to be like a permanent thing for me.
Absolutely.
So what I'll do is I'll just shed the pounds that I've been trying to shed for a while and I'm not able to. And after that, I'm going to maintain a healthy lifestyle and I'll eat accordingly and work out, and then I'll try to maintain that. Is that possible?
Absolutely. And I think she has said such a wonderful thing because she got the right message before she actually embarked on the journey of continuing with that medication. She has to make a pledge with herself. So everyone who is planning to take this medication and this drug, first of all, they need to sign a contract with themselves. That I'm going to do it short term. It's not going to be a permanent solution for my problems. I have to seek help for those problems. Like if she has a hormonal imbalance, she needs to take care of those hormonal issues at the same time. And then she has to make sure that she develops a relationship with the food the way it should have been. So she needs to develop that relationship with the food under the supervision, of course, someone who's guiding them, that what kind of a diet they should be having. People need to stay away from the protocols of fad diets. They come and they go. So they need to know that along with this weight, I'm also losing my muscle mass. And when I'm losing my muscle mass, that's when my whole body metabolism rate is also going to crash. So I'm going to consume a small amount of calories, but my muscle mass, which is actually deciding how my body is going to burn calories in future, I'm also losing that. And they need to know that they need to shed these pounds very gradually, or they're going to lose a lot of muscle mass. Number one. And that's when you get the Ozempic faces. And people, they come with all those gaunt look and all those sunken and hollow eyes, and they are terrified. So I think that's when I'm telling you that they need to be in hands of professional doctors who are very ethical, who can just grab their hands and make them walk through this journey, which is a weight loss journey, in a safe and in the most effective way.
It works.
Of course.
The wow factor is there. But wherever there's a wow factor, there is a catch.
Absolutely.
And what is the most common catch for someone who uses the drug?
The most common side effects is something which all of them, I think, feel, and that is nausea. You do feel a bit nauseous, and that can be from mild to moderate and even extreme levels. Then you can have vomiting, you can have abdominal pain. So all those side effects are very common. And I think when someone is fat and when someone is desperate to lose weight, that won't even count, number one. But the side effects, which can be really, really bothersome, is sudden abdominal pain, which is very sharp shooting. And that can really make you feel like go cranky in a way that you might have to seek medical emergency, and that is pancreatitis. When patients, they are thinking to start these GLP-1 agonists, they need to have not just the ultrasound for their abdominal organs like the liver and the pancreas, but they need to have CT scan. The other thing is to just have like a random conversation with your patients, asking them about thyroid cancer. Because in rodent and in animal studies, thyroid medullary cancer has been shown. Not in humans, but of course, if you know, because that's how Qurat Ul Ain, the studies, they work. You first try them on rats and rodents and animals, and then you start the human trials. There was a time when I started my practice, like I think 20 years back, and I used to encounter a patient of cancer once a year, once every 6 months. Trust me now, whenever I'm having a conversation with my patients, they're telling me that, my aunt had a breast cancer, pancreatic cancer, thyroid cancer, colon cancer is on the rise. So you really need to make sure that you, of course, do not have a personal history of these kind of cancers, but there's not a family history. Then you have to just do the basic lab work.
Can these drugs affect long-term health like metabolism, hormones, fertility, or even organ function?
Well, to be honest, I think you really have to kind of, specify them. Like, who's actually taking those drugs? Let's say if somebody is 150 kilos, what do you think, what's going on in his body? He's already having a full blast metabolic disorder, or he's already having heart issues and blood pressure issues, and he's on the verge of becoming diabetic, or he is full-blown diabetic. I don't know. So if you're talking about those kind of people, then even losing a little bit of a muscle mass in the long run, which is making them burn their calories at a slow rate, let's say after 1 and 2 years, is not going to be a big deal. They can handle it because they have shed so much of that extra weight that they have been putting on for so many years. On the other hand, if someone who just had to lose, let's say, 10 to 12 pounds, he's doing it and he's trying to binge on these medicines as like a fashionable thing, then of course he's going to, or she's going to lose a muscle mass, and the body metabolism rate is going to crash, and then he or she can have long-term problems in maintaining that weight, because now when they have this much of a muscle mass and this much of a fat, they have a certain, it's like a calorie burner metabolism in your body. And when you lose that muscle mass, yes, you have lost some fat as well, but you have lost a significant amount of muscle mass. That means your body is now going to have a lower burning rate of the same amount of calories that you were able to handle initially. So this is going to be a problem for this lot. But for someone who was 150 kilos, and even if they have to face the side effect, I don't think it's going to be a problem. And then, of course, as I said, you have to get the tumor markers done for the thyroid and for other cancers that we have mentioned. You have to get the baseline investigation done, pelvic ultrasound. You can get the ultrasound for the thyroid and the pancreas. And as I said, CT scan is going to be another level of making sure that you are in safe zone before you actually planning to get these drugs done. And then I know FDA doesn't really want you to get this done. I mean, in the guidelines, where I suggest that if you can get yourself a DEXA scan, which is for the body composition scan.
What is a DEXA scan?
So DEXA scan, basically, when you talk about just a DEXA scan, it's about measuring the bone mineral density. So if someone is suspecting osteoporosis in their patients, especially for females, in a certain age group, they're going to say, get the DEXA scan done. But there is another DEXA scan, which is a little more elaborate form of DEXA scan, and that is called the DEXA scan body composition, in which you can actually see how much amount of fat you have, how much amount of lean muscle mass you have, what's the fat, where is it deposited in your body, and you can actually read your body in a very different way. But again, as I said, these are just the elaborate tests that you can do for yourself to know where you are in terms of baseline investigations. And then, of course, people who are diabetic, they already have problems related to their retina. Retina, by the way, is a part of your eye, aankh ka parda. So they already have problems with that, right? That's why they need to see their ophthalmologist very frequently and every now and then.
While you're talking about this retinal thing, I've heard and I've read at many places that a lot of people who were on Ozempic or Mounjaro, they've lost their vision.
Yes,
temporarily or permanently.
So I once had a patient, this has not been really shown in clinical studies, of course, in humans, but macular edema, in which it's a central vision. So the colors are not going to be that vivid and colorful anymore. So when you're going to look at the colors, you're like, thode blurred lag rahe hain, matlab us tarah nazar nahi aa raha. So basically, आपका ophthalmologist भी baseline investigation करेगा, okay, where you are standing baseline point of view. ये ड्रग शुरू करने से पहले आपने मुझसे पूछा कि साइड इफेक्ट्स के so in real life and in real time, so one of my patients from Abu Dhabi, she didn't see me for quite some time, and I said, क्या हुआ, why didn't you come? So she said I had gastric paresis because she was on weight loss drugs. So that means the stomach, the muscles, they have just lost the ability to do the contractions and to push the food forward. So just imagine your stomach stops working. So she said I was in medical emergency. So now these are, I like to call them the side effects that I witnessed. If you're lucky, you cannot have anything, and you just took the medicine and you took it with flying colors, you've lost the weight, you're a winner. Great, good for you. But this is not how things should be done in real world. If you're taking a serious drug, you need to pay serious attention in how to take it right. We need to make a pledge with our patients, and the patients need to promise themselves that they will be trained and groomed to develop that special relationship with food the way it should have fed themselves to begin with. Number one. Otherwise, it's a short-term thing. It's going to come back. Whatever weight they have lost, it's going to come back, and maybe sometimes it's going to come back with a vengeance because now you have lost some muscle mass. So when you're doing this, I recommend that you take enough protein. I would say 1 gram of protein per kilogram of body weight. अगर आप 70 किलो हैं तो आपको 70 ग्राम ऑफ प्रोटीन चाहिए डेली बेसिस में. एंड यू आर नॉट फिजिकली टू एक्टिव. आई हैव सीन सो मेनी पीपल हु आर टेकिंग दीज वेट लॉस ड्रग्स एंड दे आर सिटिंग इन फ्रंट ऑफ यू एंड दे जस्ट टुक दिस मच एंड दे आर लाइक आई एम फुल. इसका मतलब है now you have to struggle extra to keep that muscle mass on you. Otherwise, you're losing it. And when you're losing it, your body metabolism is crashing and crashing and crashing. And one day you have to be off that drug. You have to say goodbye to that drug. You cannot be on that drug forever.
It's not lifelong. The drug isn't.
आपने खाना खाने की टेबल पे बैठे हैं. अब आप अपने स्टमक एसिड्स को concentrated रहने दें because आपका प्रोटीन breakdown स्टमक से शुरू होगा. So I feel strange actually when I go like to any restaurant for having food and I say no, I don't drink liquid. They actually look at me like this.
I actually remember that.
You remember that? Yes, we went out.
We went to a restaurant and the manager came asking Dr. Fazeela that, what would you like to drink?
Yes.
And she was like, no, I don't drink anything.
Don't drink.
And he was like he was confused.
Exactly. You see that?
Why you don't want a drink?
Because I had my liquid and my water almost an hour before my meal. Now I want my stomach acids to be concentrated, number one. And then you see these soft drinks being taken on the meal table everywhere. You took it and he was offering you some kind of a slush and different kind of cocktails.
Mojitos and whatnot.
Not just the plain liquid, but the liquid which has a lot of sugar in it. Then the bread is brought to the table. Bread with butter.
This is a conversation that I've had with Dr. Fazeela before, and I want you guys to have it too, because I think I kind of changed.
I'm glad.
Some of it, no liquids while having your meals and no bread before the food. I know it's very lucrative. I know. Go to some restaurants only because their bread is really, really good. That comes before the food.
But I have a recipe now. I'll tell you how to handle that craving. Number one, so when you take bread, what you're doing, you're giving an insulin spike. Brain कहेगा और खाना लाओ. So that's deliberately done क्योंकि then अभी आप bread खा रहे हैं, so you ordered one thing and then you'll be like because अब insulin spikes आ रहे हैं and you'll be like okay no I think I also want to have the pasta and I want to have this and I want to have that. उस वक्त just for I would say 2 to 5 minutes control yourself. पानी से dilute मत करें अपने acids. Number one, bread थोड़ा दूर रहें. Eat your proteins first. पहले प्रोटीन खा लो. जैसे ही प्रोटीन अंदर जाएगा GLP-1 रिलीज होना शुरू हो जाता है. And you have a feeling कि I start feeling full, satiated. अच्छा, फिर आपने फैट डालना है साथ. Fat and protein is a wonderful combination for your natural GLP-1 to be released by your intestinal cells. और जो आपका insulin है वो spike की शक्ल में नहीं आएगा, मगर it's going to be like a gradual insulin product. Insulin is a hormone जो कुदरत दे रही है कि अच्छा भाई खाना आ गया, शुगर आ गई है, इसको हटाइए, इसको साफ करें ब्लड में से. इसका मतलब है कि आपने स्पाइक्स नहीं लेने, तो फैट ऐड करने से वो जो इंसुलिन स्पाइक है वो आपका ग्रेजुअल हो जाएगा. आखिर में आपका कार्ब आएगा. बेशक दिमाग में रखो ब्रेड, लेकिन उसको हमेशा मैं कहती हूँ डोंट टेक नेकेड कार्ब्स. देयर इज दिस बुक, आई कांट रिमेंबर द नेम ऑफ दैट लेडी, शी इज़ अ फ्रेंच लेडी, पता नहीं शायद उसको शुगर लेडी कुछ ऐसे कहते हैं इंटरनेट पे, बट आई थिंक शी इज़ अमेजिंग इन हर टॉक्स एंड शी सेड डोंट टेक नेकेड कार्ब्स. कार्ब्स को हमेशा किसी चीज़ में लपेट लो. फॉर एग्जाम्पल प्रोटीन एंड फैट, कि अगर आपने पराठा खाना ही है तो उसको देसी घी में या ऑलिव ऑयल में या 1 चम्मच ऑलिव ऑयल का साथ ले लो, तो उसका वो जो एक ग्लाइसीमिक इंडेक्स वो जो एक आपको बॉदर करने वाला है वो नहीं आएगा. तो इसका मतलब कार्ब्स को एंड में रखो और डिज़र्ट बिल्कुल एंड में. सो अगर आप इस सीक्वेंस में खाएंगे तो आई थिंक नेचुरल GLP-1 रिलीज होता है नंबर 1, प्लस कुछ हर्ब्स हैं जो आई थिंक पेशेंट्स एंड ऑडियंस शुड नो. हल्दी, सिनेमन. कितना मुश्किल है कि आप रोज़ सिनेमन का कावा लें. जितनी आप थोड़ा गैप देते हैं अपने खाने के अंदर आपका नेचुरली GLP-1 प्लस ग्रोथ हार्मोन रिलीज होता है. सो कोशिश करें कि ट्राई टू हैव योर मील, जैसे सुबह उठे ब्रेकफास्ट कर लिया, उसके बाद गिव अ ब्रेक ऑफ 6 to 8 hours एंड ट्राई टू हैव योर लास्ट मील बाय द टाइम सन इज सेटिंग. जब अंधेरा हो गया फिर बॉडी का मैकेनिज्म चेंज हो जाता है, देन योर बॉडी इज नॉट एबल टू डाइजेस्ट इट दैट वेल.
Mostly people have dinner
after the sun has set, or
yeah.
रात को बेड में लेटते हुए and binge eating and all of that.
Ozempic faces. What is causing that Ozempic face? And by the way, I have so many people around me who are on the drug that I am an expert by looking at someone's faces, and I can tell that, okay, this person is on a weight loss drug.
If you would think that I'm taking a medication and my brain is actually going to have a message that, okay, let me just save the fat on the face and let me just burn on this side, it's not going to happen.
Exactly. You don't
it's an overall thing.
That's the thing, that they do not get to decide that where they are going to lose the weight.
Of course,
it can be anywhere.
And for some odd reason, it's mostly the faces.
Yeah.
You know, so that's why there's the terminology Ozempic faces. And for some odd reason, it's along this orbital. Eyes. It's like sunken. And I would say if someone is planning to, you know, just hop on this journey of taking the GLP-1 agonist, they really need to start taking care of the preservation of the muscle mass, at least grasp the concept. And the concept is that you have to have more protein according to the body weight, at least the minimum requirement of your body. And then you have to have the right kind of muscle resistant exercise to preserve the muscle mass. If you're not gaining more muscle mass, that's fine, but at least preserve what you have. And number 3, start working on the health of your skin. So if you can go to a dermatologist and if you can work on preserving the collagen that you have and you can preserve the fat compartments in your face, then it's going to be the best thing, because fat has a cushioning effect. You know, a little bit of a fat is going to make you look youthful. Yeah. So if you're going to lose that fat, you very rightly said that, you know what, they lost the glowing factor from their skin and they had this gloomy look in their eyes, because fat is going to contour your face.
People need to understand that taking a drug, be it a weight loss drug or they are getting fillers done or whatever, we all have different kind of bodies. My body is going to react differently than yours, and Asim's or Jamali's, like everybody's body is gonna be showing different kind of
effects. This is such an important thing that you mentioned, that sometimes these drugs, they don't even work for you to begin with. This is not for everyone. Number 1, you might not be the right candidate, and number 2, you might not even comply the way the others are complying. So that's why patients are like, oh, my friend lost so much weight in so much time and I'm not losing even a pound. So that means, yes, you're very right that everybody is different and you might not even respond to that drug. So and also I think coming back to the celebrity influence on a common man should use common sense.
Definitely.
Right? So exactly. I think that's what the audience is right now. You're talking to the common man.
But again, they should use common sense. But, you know, when you see something so lucrative, because, you know, if somebody has extra fat on their body, the level of their confidence, maybe the shame that some people have put in their minds, it affects them mentally as well as physically.
That's so true.
When they hear it and when they see people doing it, they just jump on it because they just want to get rid of it.
Yes. Don't jump on it. Take your time. You know, in those few seconds when you're planning to jump, don't jump. Just sit for a second, give yourself a little serious TED talk, and find a professional who can do it for you in a right way. And of course, it's not that they are doing it for you. I mean, you both have to be one team and do it right in professional hands in a safe way. I'm all up for it. And as I said, this is like the drug of the century. By now, everyone knows about it. It's just that the new drugs are coming up. And I think the pharmaceutical companies, they're going to, of course, make sure in the long run that the side effects are less and less, and the good effects are more and more. Of course. But at the same time, as I said, you always have to get the baseline investigations done. Do not get carried away in those few seconds when you're looking at someone's transformation. Do not fool yourself. I have so many patients coming and the husbands are like, she lost volume from the face because she was taking Ozempic. She was taking Wegovy and Mounjaro, and you need to stop her. Why you're doing it? Oh, I just wanted to lose some 5 and 6 pounds because a wedding is coming up. You see, now that's becoming like a fashionable
Yes,
thing that
exactly.
needs to be discouraged.
Yeah, exactly. Now I feel like more than a need, some people are using it
For the
as
sake
a
of fashion,
trend.
as a shortcut, and there are no shortcuts in life. You know, for people who are obese, people who have a full-blown metabolic disorder, that's another story altogether. There's another bunch of people who are just treading another trend. I'm going to eat and eat and eat because now there's a magical drug on the table which I'm going to inject in my body and I'm going to lose all the fat. So
Yeah.
there's another trend going on. I mean, you know, so
It's definitely not a trend and it should not be taken as one, because as Dr. Fazeela said, that there can be serious side effects. And if you are getting on a drug, you have to plan, you have to create a roadmap for yourself, get a good doctor, consult, get your blood work done, your scans, everything that Dr. Fazeela said.
You wrapped it in a most beautiful way that I could have imagined.
So plan that how long are you going to be on it, because again, this is not something that you're going to be doing for life. I'm really glad that we had this discussion, and I hope that the audience, because a lot of people are now planning on getting onto this drug.
Absolutely.
I hope they got some insight on the drug and how to take it, how not to take it. And again, as doctor said, that it might not be for you. So you have to check before you jump on the bandwagon.
And can I say one thing?
Yeah.
I think whatever I had to say towards the end of the conversation, Qurat Ul Ain said it in the most elaborate and a comprehensive way. And I couldn't be, saying this again the way she said it. So whatever she said in the end is what I want to say. And this is how we're going to wrap up the conversation. Brilliant, Qurat Ul Ain. That means if you got it right, the audience got it.
Thank you so much for your time, Dr. Fazeela. And
it was a pleasure.
I'm hoping that we'll be seeing each other again soon.
Absolutely.